Good afternoon, and welcome to our virtual town hall devoted to planning for fall 2021 at Johns Hopkins University. I'm Lainie Rutkow, a professor in the Bloomberg School of Public Health and senior advisor to President Ron Daniels. I serve as one of the team members leading our COVID planning efforts. I'm delighted to be moderating this session with 5 of my university colleagues who lead our 2021 planning work. Today, I'm here with John Links, Professor, Vice Provost, and Chief Risk Officer, Heidi Conway, Vice President for Human Resources, Jane Schlegel, Vice President and Chief Administrative Officer, Stephen Gange, Professor and Executive Vice Provost for Academic Affairs, and Alanna Shanahan, Vice Provost for Student Affairs. The goal for today's session is to discuss the university's plans for the staged return of activities on our campuses and to answer your questions about the fall planning process. As we noted in a message that was sent earlier this month, we have the hope and expectation that the university will be substantially back to normal this fall. Before I turn things over to our panelists, I want to take a moment to describe the consultative process that accompanies our planning. First and foremost, our priority has always been ensuring the health and safety of our community to the best of our ability, and we continue to be guided by our medical and public health experts in responding to this evolving pandemic. We have assembled multiple COVID-specific groups that routinely provide advice, consultation, and feedback to university leadership. These groups include a health advisory group composed of leading Hopkins public health and medical faculty experts, a student advisory committee, which includes representatives who span our student body from freshmen through doctoral students, and the University Pandemic Academic Advisory Committee, which includes faculty representatives from the university's different schools. We continue to employ a framework of 3 phases of operation based on state and local regulations, and also our own experts' assessment of the public health situation. In phase 1, the university offered online learning and robust virtual student experiences. We're currently in phase 2, which allows, among other things, a smaller number of students living in on-campus housing, to-go dining, limited seating in common areas, and classes offered both online and in person in a reduced density setting. We anticipate that in the fall, we'll be in an intermediate phase between our current operations and truly back to normal. In our announcement for this session, we ask that you please send us questions beforehand, and we appreciate the many that we've received. Below this screen is also a box that will allow you to send in questions in real time. We'll answer as many of the questions submitted by participants as we can. Like our other sessions, this town hall is being recorded and it will be available for asynchronous viewing. I'm now going to invite each of our panelists to give brief opening remarks, and then we'll move on to Q&A. First, I'll turn to John Links. John is going to speak about measures being taken to mitigate the health effects of the pandemic in the Johns Hopkins community, and that will include vaccination. John, over to you.
Hello, everyone. I want to start by emphasizing that, as has been the case since the start of the pandemic, health and safety remain our #1 concern. As Lainie mentioned, last fall, in fact, as far ago as last March, we created a multi-phase plan for return to campus. And Lainie talked about phase 1, phase 2, and phase 3. Last fall, we were in phase 1, which represented a low density on campus. This spring, we're in phase 2, a medium density on campus, and we're expecting to maintain that through the summer. As Lainie mentioned, for the upcoming fall, we're planning to be in what we call phase 3A, which represents a near normal density on campus with some additional precautions: masking, enhanced room ventilation, testing, and of importance, mandatory COVID vaccination for students and maybe for employees on campus. As has been the case all along, we will adjust our operating posture in real time based on prevailing public health conditions in Baltimore, the state, and DC. So, saying we'll be in phase 3A in the fall is not an ironclad guarantee, but our aspiration. and it'll depend on having low prevalence and community transmission in mid-August, which is 4 months from now. That means it's not about where we are now. We would, of course, not go into phase 3A with today's conditions. And last fall, when we aspired and planned to go into phase 2, we stayed in phase 1 because of the conditions last August. So if we go into phase 3A this fall, as we're planning to do, it will be because the public health situation supports it. With respect to workspaces in the fall, we've learned a lot about how the coronavirus is transmitted from one person to another this past year. We've also been reminded of all the environmental science we already knew about the transmission of viruses. We're counting on masks to stop large droplets and enhanced room ventilation to deal with the smaller airborne aerosols in the fall. Open workspace plans without barriers are fine, as are shared offices. We do not anticipate the need to retrofit spaces, for example, with plastic barriers. Now, this guidance for the fall will likely evolve over the rest of the spring and summer, but that is how we're planning right now. In this regard, we have already assessed every lab, classroom, and shared space across our campuses for adequate ventilation. And you may recall from previous town halls and other communications that we significantly increased ventilation and filtration in many spaces. We're right now in the process of reviewing office spaces. Given the huge number of offices across our campuses, our approach is to ensure that the floor-by-floor ventilation is enhanced rather than going into each and every office. In the fall, we do not anticipate having restrictions on bathrooms, elevators, or other such spaces. We do anticipate increasing indoor and outdoor eating spaces. Finally, with respect to COVID vaccines, they are highly effective, in fact, incredibly so, against severe illness, hospitalization, and death. They have not been studied as much for infection per se, transmission of the virus to others, or mild to moderate illness. It's likely the vaccines are very effective here too, but even if you're vaccinated, you should continue to wear masks and for now distance from others. And in the fall, as I said, we will still require everyone on campus to be maxed. And please do get vaccinated. While it's not a 100% guarantee of safety, and while we will have other control measures in place in the fall, it's an extremely important way, perhaps the most important way, to protect yourself and others. In the fall, we're planning to provide vaccination for affiliates, students, staff, and faculty who have not yet gotten it. For example, international students. Having said that, we will accept international vaccinations as fulfilling the mandatory student vaccination. We are not in a position yet to promise vaccination for families of affiliates. We'll use a system similar to that we've used for seasonal flu vaccination to ensure that all students on campus are vaccinated. And that system includes the ability to upload proof of vaccination. So with that, Lainie, I'll turn it back to you.
Thanks so much, John. I'm now going to turn to Heidi Conway, and Heidi will speak about issues related to human resources, including return to work. Heidi, over to you.
Thank you, Lainie, very much. Good afternoon, everyone. First and foremost, I just want to take a moment to thank each of you for your hard work and dedication to the university and to our important mission over the past year. The times have certainly been challenging, and you all continue to amaze me at how you've continued to support the important work of Johns Hopkins. We are all deeply grateful to each of you for all that you're doing. As we head into the summer, I want to highlight some of the key planning efforts and supports that continue to be available. First, regular in-person contact among faculty, students, and staff is fundamental to the vitality of our university. The presence of our staff in Baltimore is also critical to our role as an economic anchor in the city, and we are really anxious to reconvene as a community as quickly and as safely as we can. We also recognize that our collective return may look different from our past normal, and we must incorporate the lessons learned over the past year about balancing work, home life, and general well-being. As conditions improve, we are looking forward to planning for a majority of our staff and faculty to return to campus in person by mid-August for the start of the fall semester. Exceptions will be made in cases where staff members have received accommodations through the Office of Institutional Equity or had pre-COVID alternative work arrangements. We are very mindful that for many, the resumption of in-person work may be affected by whether or not your K through 12 children return to in-person school and other COVID-related childcare and caregiving obligations. And we will work closely with units to address these issues as they arise. We also know that some of you would like to return sooner, and we will provide opportunities to do so early in the summer. As always, there may be discrete areas and roles where more flexible work arrangements are best, and we anticipate differences between business units or functions in what the return to in-person work looks like. We, like many organizations, are thinking deeply about the future of work, and university leadership will take a considered and consultative approach to our long-term policies, guided by clearly articulated principles that are informed by research, deliberation, and data. We have convened a staff working group to collaborate with our deans, staff members, and consultative bodies such as the University Pandemic Academic Advisory Committee to develop those guidelines and templates for various work arrangements. And we will share our thinking with our community in the coming weeks. High level, here's what our planning looks like. We will develop a set of guiding principles for our return to campus plans that begins with safety as fundamental to our planning. We will develop a framework for divisions and leaders across the institution to support their developing plans for returning to campus. Our goal is to have this out to divisions and managers by early May. Once leaders develop their plans, we will review them to ensure they sufficiently support our operating plans, as well as follow our guiding principles around safety for our return. Leaders will submit these plans by early June, and our goal is to have a plan where we begin returning our staff to campus starting in early July for those who are eager to return, and by August 15th for all others. We expect that many more folks will be needed on campus than has been the case for the past year as campus operations ramp up to more pre-COVID levels. Again, we are committed to ensuring that you have sufficient time for planning your return to campus. We are working to update the return to campus guide. The guidance will be updated with the latest campus requirements, as John talked about, and changes as a result of COVID-19 and the different supports available, as well as testing locations. This guidance will be key support for all of us as we return to campus in the fall. We will share the guide with all of you as we prepare for the new academic year. I did want to mention the social compact. We talked about this in the fall. We did have a broad group of diverse faculty, staff, and students that did a really phenomenal job developing a social compact that establishes norms around behaviors to control COVID-19 transmission and that supports the safety of our community. We will ask that all members of our community engage in these safe behaviors as we return. Regarding the flu shot, we continue to make the flu shot available to all of our faculty, staff, and students, whether on or off campus through Walgreens or through your health and pharmacy plan. Once again, we are requiring that all faculty, staff, and students who are on campus have the flu shot by November 20th. And finally, just a quick note on childcare and other HR supports. As we continue to work from home and begin to plan for our return to campus, we continue to face challenges with childcare support, unforeseen financial hardships, and mental health and wellness. Please visit the HR website or call our Benefits Service Center for more details on all of the supports available, hr.jhu.edu. And then one final update in closing. Over the next several weeks, we will be doing educational town halls across JHU for Get the Facts on the Vax. So these are educational sessions that are a conversation and education around the COVID-19 vaccinations. And so with that, I will hand it back over to Lainie.
Thanks so much, Heidi. I'm now going to turn to Jane Schlegel, and Jane will speak about campus operational planning. Jane, over to you.
Thank you. Good afternoon, everyone. Thanks for your time today. As previously mentioned, we have departments and divisions that are developing brief and tailored plans to guide staff return. The DBO, in concert with facilities and operations, will be reviewing proper spacing and air ventilation. Last June, we did this for the return to campus for research, and then we did it again for spring with the classrooms. And so our focus now is turning to offices and open spaces, as well as eating venues. Facilities is calculating air exchange per hour, fresh air percentages, and filtration levels to make sure we're meeting best practices. We are also consulting with the Health, Safety, and Environment Department while doing those calculations. Generally, restrictions on most facilities will be lifted with guidelines being developed for shared office and eating spaces. As John mentioned, the expectation will be to have no restrictions on elevators, restrooms, or even entrances, exits. In the past year, we've had, entrances inflow and exits. All of that will be taken away, basically. Any kind of J card access that we've had in the past, we plan on for business hours to not have that implemented during the fall. Continued mandatory face coverings will be in place, as well as enhanced and frequent cleaning. From a testing perspective, we will have testing in the fall, certainly through the summer under the phase we're in now, but we will have testing in place for the fall. We are working through the guidelines as to what that requirement will be, as well as we'll still be using Prodensity from a compliance perspective. Safety ambassadors that we've had employed for the entire last year will still be employed and walking campuses, walking buildings, and making sure that folks are complying with our protocols for masking and distancing. And last, I just want to mention that we got one of the questions early on having to do with temperature checks. We have not done that all year. We do not plan on doing temperature checks as folks enter the buildings. With that, I'll turn it back over to Lainie. Thank you.
Thanks, Jane. I'm now going to turn to Stephen Gange. Stephen will speak about academic planning and also international student concerns. Stephen, over to you.
Thank you, Lainie, and good afternoon, everyone. And thank you for participating in this town hall, as well as all of your resilience throughout the last year. As we announced in the university-wide message, we expect a broad resumption of on-campus academic activities. We made this announcement knowing that this is but a plan, and as John Links mentioned, we're highly dependent on the public health situation. We've been learning from our on-campus activities, and while we have not had in-person instruction like pre-pandemic levels, Johns Hopkins has been open and conducting in-person activities. We have not seen any transmission of COVID linked to instruction. Further, we've had extensive research activities ongoing since June and have also not seen transmission in this setting. Further, we've been talking with our peers who have brought back students in a more fulsome way over the last 2 semesters. We've been learning from those who've been successful at holding the virus at low levels in their community, as well as those that have struggled with outbreaks. In our conversations with them, reflecting our own experience, instructional settings have not emerged as an area of concern. So as we prepare for fall, we are expecting a broad resumption to many in-person activities. Our academic calendar will continue as normal. The first day of class for fall 2021 will be August 30th. All planned instructional breaks will continue without modification, including Thanksgiving recess. As in the past, grading policies will continue to be determined by individual divisions, but we expect many grading policies will return and revert to pre-pandemic policies. Divisions have been preparing their fall schedules so that registration for fall can begin. I caution, just like all other terms, you should be flexible and expect there may be some changes before fall actually commences. With the conditions that we expect in the fall, in combination with the required vaccination of students, we are planning to remove most of the restrictions on density in classrooms. Generally, course modalities will return to normal, and most courses that were previously had in-person instruction will return to that modality. While we have many outstanding programs that are offered online, we all recognize the value of in-person interactions between our students, faculty, and staff, and are working to resume this in the fall. We are keeping some additional measures for how classes are planned. Courses with more than 50 students generally are moving either to online or being divided into smaller sections. We are looking at exceptions on a case-by-case basis based on pedagogic need as well as other conditions for the class. Importantly, in-person classes will not be mandated to have online remote options, and that will eliminate the optionality for students who cannot or choose not to return to campus. Generally, if your program was fully in person before COVID disruptions, you should plan to return for fall. Divisions may develop specific sections or courses for particular groups of students that may have some special options or difficulty returning to campus. And one of those groups that we think is worthwhile discussing are international students. We recognize international students may continue to experience disruptions in their plans to travel back to attend classes in person. We expect that there will still likely be some travel restrictions, as well as challenges to students getting appointments for visa processing. We've asked each of our programs to make an assessment to determine if there are opportunities for students to continue to make progress in their studies while not being on campus. In some cases, it may be a continuation of online options. In some cases, it may be the development of study away programs. It's very division and program specific. And program directors and advising are working with students individually to help them identify opportunities. So with that, Lainie, I'll turn things back to you.
Thanks, Stephen. I'm now going to turn to Alanna Shanahan, and Alanna will be speaking about planning for housing, dining, and other topics related to student life. Alanna, over to you.
Great. Thank you, Lainie, and welcome everyone, and a particularly warm welcome to our students that may be joining today. So a few key updates. Wanted to basically set the stage for returning to a more normal, more traditional student experience. With respect to housing, we do expect to have nearly full capacity in our residential halls. The one piece of housing we do plan to eliminate is our triples, but otherwise do expect to be at full density with a full complement of resident advisors come fall. We also plan to post information around housing at the end of this month for our first and second year students. And the actual housing process will begin at the end of May. And we expect to make assignments in the middle of July. So also with respect to housing, as Stephen mentioned, we are reinstating our residency requirement for first and second year students. But with respect to international students in their first or second year who may struggle to return to the US, we're happy obviously to work with those students on an individual basis. With respect to dining, something unfortunately we've all missed, in-person dining, we are hopeful to return to a de-densified dining experience. We'll still offer grab and go and mobile order options, but we do hope to reopen our dining halls. And we do plan to utilize the temporary structure located in the freshman quad as a dining overflow option. One thing we'll hope to pilot this summer is actual de-densified dining in Levering Hall as a bit of a test case, public health conditions allowing. But excited to possibly try that this summer, particularly for those who have been on campus and need a place to dine safely. So let's talk a little bit about schedule for the fall. So we do have a tentative, in essence, move-in and orientation schedule. A lot of activity will ramp up in August with RA trainings, pre-orientation sessions, our first year mentor move-in. But for most of you, first year move-in would be August 21st and 22nd, with basically testing in the day or two following. And then second year move-in would be August 26th and 27th, with again, sort of testing happening the following day. We expect new student convocation to happen on August 29th, and we expect our orientation program to begin on August 24th. So August will be a busy month. And again, more detail will be sent to everybody, but did want to preview that for any students who may be on the Zoom today. Also, something that's worthy of note, we are planning a welcome weekend, the weekend of August 28th, 29th, which is really an opportunity, obviously, to engage our first year students, but to really engage those second year students who have not had a particularly traditional first year experience and find ways to connect them not only to our campus and our community, but to their peers. So that welcome weekend will be a wonderful weekend for our entire student body, but also one that's very much focused on ensuring that our second year students have an appropriate connection and acclimation to our campus environment. So excited for that. Also, just with respect to events and student organizations, excited again to return to something that feels a bit more meaningful. A lot of work over the summer as far as working with our students around support for their orgs, budgeting, events and event planning, and providing summer webinars to make sure students are up to speed as to how we'll plan to tackle the fall and their student events and experiences. We definitely anticipate opportunities for infinitely more in-person events. Very excited for that. And again, we will continue some virtual options. We do appreciate that some students, again, will struggle to return to campus. So for the services we provide, as well as some of our engagement opportunities, virtual options will be available for most. Also, finally, excited about returning to some fall traditions. So hopefully as students return to campus in the fall, they'll remember experiencing events like Blue Jay opening day and eventually lighting of the quad, something that feels much more like what you experienced previously. So excited for all that. I think, Lainie, those are the highlights. And I know we have a long list, so I'll turn it back to you.
Great. Thanks so much, Alanna. I'm now going to turn to the questions that we've received from our audience. And I want to say to our audience, thank you. I'm keeping a very close eye on the Q&A module, and I do see your many, many questions coming in. So thank you, and please continue to submit them. I'll be watching them closely for the remainder of this session. Because many of the questions have similar content, I'm going to do my best to batch them to ensure that we answer as many of your questions as possible. John, I'm going to start with questions for you that concern mitigation of health effects of the pandemic. We're seeing a lot of questions come in about masking. What do you anticipate will be the university's masking stance come the fall?
So first, I want to say that as I'm answering these sorts of questions, please bear in mind that the assumptions for the public health conditions in the fall are quite different than what we're experiencing now. And we would not right now go into the same operating posture we're describing for the fall. So everything is contingent on very low prevalence of disease and very low community transmission. With respect to masking, masks will be required indoors for certain. And the only exception to that will be the only exception right now, which is when eating in a common space. In this regard, a common space is not a shared office, and it is most likely that eating will not be permitted in shared offices.
Thanks, John. Additional questions for you. What do you anticipate travel restrictions will look like in the fall?
So right now, of course, travel under the aegis of the university is permitted, but only when it is deemed essential by your school. In the fall, we anticipate a loosening up of that language so that more university travel will be able to occur.
Thanks, John. And while we've all talked extensively in this session about our planning for the fall, one thing that we haven't touched on is what plans will be in place should we experience a COVID outbreak on campus. Can you speak to that, please?
Yes. So we did experience a small outbreak this spring, and that can serve as a guide to how we would react in the fall. The answer is, depending on the specific nature and characteristics of the outbreak, we might suspend certain activities. We might increase testing. For residential students, we might have them stay in their dorm rooms and so on. It will, of course, depend on the specifics of the outbreak, but we're poised to take immediate action.
Thanks, John. Another topic that's come up across our presenters in this session is density restrictions and how this is likely to be handled for the fall. I'm seeing a lot of questions come in about this, and they range from density restrictions in offices, labs, elevators, bathrooms. Can you speak overall to that planning effort, please?
Sure. So the plan for the fall right now is that labs and classrooms will, in essence, be back to normal density. Of course, that's with masking in place and with enhanced ventilation compared to pre-COVID times. Other spaces will have varying requirements. For example, dining will not at all be back to pre-COVID density. We are planning for some very limited dining, but mainly dining will continue to not occur in the dining halls or other usual dining spaces. We think that elevators and bathrooms will be back to normal density. Both of those are spaces where a given person's time in that space is limited, and where in the setting of low prevalence and transmission, it doesn't make sense to limit density.
Thanks, John. We're also getting, no surprise, a lot of questions that concern the COVID vaccine. So I'm going to stick with you, but switch to that topic now. First is, for those who are fully vaccinated, how can they let the university know? So people are getting their white CDC card. What I'm seeing is folks are asking, is there a place to upload that? Is there an email address? Can you talk us through that, please?
Sure. Right now, there is no mechanism for you to let us know. That will change. We are building an application right now that is very similar to the one we've been using for multiple years now for the seasonal flu vaccination. And that application will allow you to upload documentation that proves you've been COVID vaccinated. The type of documentation we will require has not yet been determined. It may be the CDC card. It may be something more or other than the CDC card. But in exactly the same fashion as we've used for the flu shot, we will have a system in place by July 1st that will permit affiliates to upload their COVID vaccination documentation.
Thanks, John. And this next topic, I know you touched on in your opening remarks, but I want to revisit it because I see it's coming up quite a lot in the questions. And this concerns mandatory vaccination. So can you please talk through the current thinking for students, faculty, and staff?
So we have already announced mandatory COVID vaccination for the fall for students. That is as of August 15th. Right now, we are strongly encouraging staff and faculty to get vaccinated. As we go on this spring and summer, we continue to consider whether we want to require COVID vaccination for staff and faculty. So right now, we're strongly encouraging it. We may stay with that, or we may at some point switch to a mandatory requirement.
Thanks, John. Another question related to vaccination. So we are beginning to learn more about the potential for so-called breakthrough COVID cases, meaning that folks who are vaccinated subsequently contract COVID. So the question is, given that knowledge, how can we be thinking about fall planning in the way that we are?
So you may have heard me talk before about what I call the Swiss cheese model of control measures. So every single control measure is like a slice of Swiss cheese. And you're trying to line up a number of control measures, that is, line up a number of slices of Swiss cheese so that the holes in one slice are covered by the solid areas in other slices. And at the end of the day, you have a barrier with no holes in it. So masking, room ventilation, hygiene, testing, and vaccination are all control measures that we think are important for the fall. None of them is foolproof by itself, which is why we have a series of control measures. With respect to COVID vaccination, I don't like the term breakthrough because the COVID vaccine has never been said to be 100% effective. So it's not breaking through the vaccine, it's just the small fraction of illness that isn't prevented by the vaccine. And what we're trying to do is have multiple control measures on top of vaccination so that we limit transmission on campus. And as Stephen said, we actually have no evidence of transmission on our campus in labs and classrooms. Getting the vaccine, we think, is incredibly important. It's highly effective, but it's not bulletproof by itself, and we're not treating it as such.
Thanks, John. I'm now going to turn to Heidi, but you and I may see each other again during this session. Heidi, a lot of questions coming in, no surprise, about return to work and the university's thinking. So first question for you is, can you speak to the university's consideration of what other entities, including peer institutions, are doing for return to work in fall 2021?
Sure, Lainie. I'm happy to speak to that briefly. We are closely looking at peer institutions and other organizations, as many of our peer institutions are looking at us as well, to understand how they're navigating the return and what makes the best decision for that organization. I will say each institution has its own policies and practices and situations to navigate. So I think you're seeing a little different solutions around return across our peer institutions.
Thanks, Heidi. And this next question, which is representative of many questions that are coming in, speaks to some of the themes that you addressed in your opening remarks. So could you talk us through the university's current thinking about work from home or return to work or hybrid models as we head towards the fall?
Sure. I'm happy to. I think first and foremost, I want to recognize that during the pandemic, we have asked people to work remotely, and they have done so incredibly well. And we appreciate that in terms of, what has been needed at the time. As I mentioned earlier, our campus community and our kind of in-person contact among our faculty, students, and staff is really fundamental to our vitality as a university. Our presence in Baltimore is also critical to our role as an economic anchor in the city, and we're anxious to really reconvene everybody. And again, you've heard this theme throughout all of our comments, as safely as we can. We also kind of recognize that our return may look different from our past normal. And so our goal is to incorporate the lessons that we've learned over the past year and incorporate them into our campus return plan. I did talk very briefly about, how we will make exceptions and those around alternative work arrangements. And those will be through the Office of Institutional Equity around accommodations. We also recognize, as I mentioned, that, resumption of in-person activities may be affected by childcare and caregiving arrangements. So we will be looking closely at those with the different divisions and units across as they arise.
Thanks, Heidi. Another question for you. As the plans become more clear for the fall, will HR offer some type of workshops for planning for return to work, both for managers and directors and also for staff?
Absolutely. I think it will be important in terms of all the things that we're talking about today, that we review and share broadly. So I imagine you will see a town hall approach where we talk about the safety guidelines, we talk about the return parameters, we talk about some of the things that will be different from when we were last on campus. We are committed to ensuring that folks have time to prepare and that they have all of the information that they need to return safely.
Thanks, Heidi. And one more for you, and this is something that you touched on in your opening remarks. Can you speak more about the role for staff to play in the planning process for fall 2021?
Sure. So we, as I mentioned, we are committed to ensuring that we are including all of the members of our community. So we will be having conversations with different key groups across the university. We have convened a group that is focused on the staff return in particular. And we will be setting up a staff advisory committee or council. I'm not sure what it's actually called yet, in the coming weeks to help inform our return. And of course, if folks have feedback and want to share it, my email is always open. So I'm happy to hear feedback.
Thanks, Heidi. Jane, I'm now going to turn to you for questions that relate to operational planning. And some of these pick up on topics that you introduced in your opening remarks. So the first concerns temperature checks, and what should folks anticipate in the fall relative to those?
So, sorry about that. Working from home. So for temperature checks, we do not plan on doing any of that as you enter buildings. We have testing and compliance in place. So, and that has worked really well over this last year. So we will continue to do that. Sorry.
It's real life. And Jane, following up on what you just mentioned, especially for testing, what right now do you think testing may look like in the fall? And can you speak to it, especially in terms of testing for those who are vaccinated? What's the current thinking?
So the current thinking is that we will have testing in the fall, even if you're vaccinated. We want to make sure that we do at a minimum a surveillance check across the university to know what we have in terms of, COVID positive or negative. So it will be important for us to continue our testing protocol. We have not settled on whether that's going to be once a week, twice a week, or truly just a surveillance. So at this point, we are trying to work through those.
Thanks, Jane. And I'm seeing a lot of questions come in that relate to dining for faculty and staff. So how are we thinking about that now, and especially making sure that there are enough spaces throughout the campuses for folks to safely eat?
So that's one of the things that we want the DBO and the divisions, along with their facilities operation team and Bob McLean's team as well. We're working through that as part of the plans. And so we will have a better idea of how we're managing the eating. It is a big question, and certainly one that we need to make sure that we are ready for and have the space to be able to have folks be able to eat, especially folks in shared offices. And then some of those large open dining areas. We just need to make sure we've got proper distancing there as well.
Thanks, Jane. And final question for you concerns, a lot of questions coming in about workspaces and how we're thinking about those in the fall, but particularly for those who are in open workspaces and what the planning looks like. So could you speak to the current thinking on those things?
Sure. As John talked about in his opening remarks, we do not in those open spaces. We will make sure there's proper distancing, but if you are masking, that is the number one protocol, along with the air ventilation that we are checking, the exchange per hour, fresh air percentage. So there are not plans to put up like plexiglass. We feel like those are the proper protocols, and we will follow those. And as each division goes through their plans, they will be going through their space to make sure that they've got, again, the proper distancing and airflow in there. So
thanks, Jane. Stephen, I'm now going to turn to you for questions about academic planning and also international students. So first question is, will pass-fail continue to be an option heading into the next academic year?
So as I said in my remarks, grade policies are determined by each division individually. And I don't think they have gotten together to talk about what grade policies will be in effect in the fall, but I expect they will be doing so soon. So I would tell students, and their families to look out for messages from the divisional academic officers about their own grading policies.
How, for courses that involve day or in a few cases overnight field trips, what should they be thinking right now as they look towards the fall?
As I said, there's a broad expectation for a resumption back to normal. So if there are field trips as part of the educational experience, I expect that they would be part of the upcoming fall. I saw there was also a question about students who are working while away. from campus? Would there be an expectation for them to return? And the answer is no. It is a return to activities as they were before the disruptions hit a year ago. So if you're a PhD student doing field work in some part of the world, of course, that's perfectly appropriate for you to continue to be doing that, just like it would have been prior to last March.
Thanks, Stephen. Question about courses over 50 that will remain online, and the statement that this is for both health and pedagogical reasons. Could you explain what's meant by the pedagogical reasons, and does it have to do with staffing for those courses?
It really is for two things. One, as John mentioned, as part of our Swiss cheese model, we are looking at a broad elimination of our density requirements, but we recognize there may be some activities that still need to be restricted. Dining and density around dining being one of them, and then density in large classes being another one. And as Alanna said, also triple suites being a third area. So we have been working with the divisions on assessing for large classes what is the best approach. In some cases, it's for them to move entirely online. In some cases, it may be that they have designed their course specifically to involve active learning strategies or have other pedagogic reasons for an in-person meeting of that course. So we're ensuring that those courses are meeting in spaces that, while we don't have specific density requirements, are in a more de-densified setting.
Thanks, Stephen. I'm now going to stick with you, but turn to questions that are focused on international students. And I know you touched on this in your opening remarks, but I'm seeing several questions related to vaccines received in home countries, and how will we handle those when they're for international students?
So it's a great question. We've consulted with our health advisory group and have endorsed their recommendation for an acceptance of international vaccines as meeting our requirements. So when we put together a system that would allow you to upload your information, we will incorporate ways for international students to upload their information about those vaccines.
Thanks, Stephen. And to piggyback on that question, what about international students who are not yet vaccinated? Will they have the opportunity to get vaccinated when they arrive?
So that is something that we're working on. I don't think I could, on this call, make a guarantee about that, but we're working hard with Johns Hopkins Medicine so that vaccines would be available for international students returning to campus.
And at this point, Stephen, do you foresee challenges for some international students who may have trouble returning to campus, either because of visa or other issues? And what advice do you have for them?
So the issues that we foresee occurring are more logistical issues than anything else. Travel restrictions may continue in the fall. As I mentioned, we've heard that consular offices are still not operating at 100%, and so students may have difficulty going and getting appointments so that they can get their visa documents squared away. In terms of the actual requirements, as I indicated, we've been working with the programs even since last year on how they are supporting and providing their instruction to international students. The SEVP issued a set of regulations last year that relaxed some of the strict conditions for international students. Usually they're quite limited in terms of the number of online classes that they're able to take, usually restricted to just one a term. So they made some guidance that we assume is going to be continuing into the fall. And we've been communicating with the divisions and programs about how to plan for a continuation of those conditions.
Thanks, Stephen. And finally, Alanna, I have a few questions for you about student life. One picks up on topics that you touched on in your opening remarks. Could you say again what students should anticipate for the fall in terms of the return of in-person clubs or other extracurricular activities?
Yeah, our hope is that we're coming closer to a full return, clearly. That's our plan. Obviously, the public health conditions will dictate whether or not that's possible. But our hope is to provide a good amount of guidance over the summer as we get closer to fall semester as to what will and won't be possible. But our posture at this point is to make as much in person with obviously a preference for some outdoor activity, particularly while the weather is still nice, but providing students those opportunities and options that they have become accustomed to having. And whether that's, again, the opportunities of our arts organizations. Again, we have over 400 student organizations. So we want to see many of you return to what you love, and we're attempting to make the plans to make that possible. But again, the summer will be a critical point during which we communicate what we believe will be possible come late August and return to campus.
And Alanna, I think you just answered my next question, but I want to make sure that everyone heard the answer, which was, when should students anticipate the timeline for receiving more information about the fall?
Yeah, I think for student organizations and their operation, the summer will be a critical time. We want to give you obviously plenty of time to prepare, but get as close as we can to what the operating conditions will look like come fall semester. And as I mentioned in my opening remarks, with respect to housing, a lot of information as far as what to expect will come out the end of this month. And then come the end of May, we'll actually start the housing process. So those pieces will begin at that point. We're pretty much ready, probably in the next 2 weeks, to announce sort of the definitive timelines as to, RA move-ins and pre-orientation programming and what many students expect to see as far as how we ramp into August. Still waiting for some key pieces around kind of athletics and what that will look like. But again, I think particularly our undergrads will hear a lot of communication from my office, starting now and with respect to housing and dining, and then a bit more so over the summer with respect to student orders and athletics.
Great. Thanks so much, Alanna. And I see that we're coming up quickly on 2 p.m., which means I'm going to switch into wrap-up mode. So I'd like to close out this town hall by thanking all of you for joining us this afternoon and for your continued efforts during these disrupted times. And while I know that we weren't able to answer every single question that we received, I do hope that this session has provided further clarity for you about our planning for fall 2021. As with previous town halls, this session has been recorded and it will be made available. Thank you and stay safe.